the national government, working hand in hand with the county government, is committed to ensuring the highest attainable standards of health. Under the able leadership of the Secretary for Health, we will achieve this objective by, among other interventions, improving our healthcare infrastructure throughout the country, restructuring and transforming KEMSA into a robust institution with effective devolved distribution network to avail medical supplies to healthcare facilities. And 3, redeploying existing healthcare personnel while at the same time recruiting additional personnel to make access to quality healthcare a reality in our country. I have, in this regard, honorable members, allocated an additional Kenya shilling 31.6 billion over the MTF period. Starting next financial year, a total of Kenya shilling 10.6 billion has been proposed, of which 3.8 billion is for free access to maternal health, and Kenya shilling 700 million for free access to all health centers and dispensaries. I have allocated a further 3.1 billion and Kenya shilling 522 million for recruitment of 30 community nurses and 10 community health workers, respectively, per constituency to provide quality healthcare services to Kenyans. Access to healthcare would not be complete without available and accessible personnel. Accordingly, I have allocated another 1.2 billion for provision of 1,500 affordable housing units to healthcare workers to enable them respond and attend to patients in a timely manner. Honorable members, we are not just making healthcare services accessible to Kenyans in rural and urban areas. We are also extending this critical service to our brothers and sisters living in slum areas in our major cities and urban areas. To this end, I have allocated Kenya shilling 200 million for the construction of healthcare facilities in slum areas of Nairobi, Kisumu, and Mombasa. Poverty and vulnerability pose significant risk to the well-being of some members of our society. With over 50% of Kenyans living below the poverty line, we have prioritized cushioning those less fortunate, poor, elderly, and persons with disability in our communities. We have in this regard allocated a total of 13.4 billion as follows. Kenya shilling 8 billion is for doubling the number of orphans and vulnerable children under the cash transfer program from 1,500 155,000 household to 310,000 household. We have set aside Kenya's shilling 3.2 billion for increasing twofold the number of elder persons under cash transfer from 59,000 to 118,000. Kenya shilling 770 million for doubling coverage of those with extreme disability from 14,700 to 29,400 households. Kenya shilling 452 million for doubling the number of other disabled persons under coverage of cash transfer. And Kenya shilling 400 million for presidential secondary school bursary scheme for orphans, poor, and bright children. Kenya shilling 356 million for urban food subsidy, and Kenya shilling 100 million for albino.